On March 28, 2012, a study related to the Fit for Work project was presented in Riga, one which focused on the effects of musculoskeletal disorders on the national economy. According to the Work Foundation, which is an NGO, such disorders cause economic losses of between 64 and 255 million Lats a year. The number of people assigned to a level of handicap because of musculoskeletal disorders nearly tripled between 2004 and 2010. The aim of the Fit for Work project is to encourage governments to do everything possible to protect people against disorders which can lead to an inability to work. The patron for the project is Kārlis Šadurskis, and he took part in the presentation of the results. Others who attended were Health Minister Ingrīda Circene, the Parliamentary Secretary of the Ministry of Welfare, Arvils Sašarādens, representatives of organizations of patients and doctors, patients, and specialists from the sector. At this time, it appears that the project may be of greater value than we can imagine. The most important thing here is that when we talk about one group of disorders, we can essentially improve many aspects of the healthcare sector. This applies not just to the sector, but also to the entire country in terms of attitudes toward the healthcare sector. The first thing is that people and other sectors must understand that the healthcare sector does not create a result for itself, because the resources that we invest in healthcare represent benefits for the public at large. We have seen that this is of essential importance in this group of disorders because here we face vast costs for the country's welfare system. When we see the enormous ocean of unresolved problems in Latvia, we give up and believe that there is no point in beginning new things. We probably will not achieve anything. And then there are projects such as Fit for Work, which make it possible to separate out one range of problems which allow us to be very specific in terms of deciding on what the problems are, and, no less importantly, what the solutions are. We saw that today, and I believe that we will also see in working groups that money is not always the solution. We have various instruments. There are various explanatory programs which we can use to change approaches or stereotypes. Another is subsidies for jobs, which, in the case of differently abled people, is extremely important. For differently abled people, compensation for some of their inability to work involves a pension, and we can also pay compensation to the employer for the inability to work so as to strike a balance between the needs of the employer and the harmonization of this process. That is our main responsibility. The sad fact is that diagnosis as such is hardly ever discussed in the Latvian healthcare sector. We talk about treatment and rehabilitation because no one talks about whether a diagnosis has been correct or incorrect. The only discussion is about diagnoses, rehabilitation, and the spending of a lot of money. If the diagnosis is correct, then very little money has to be spent. Treatment is a second problem. Today we heard that the state pays for the biological medications that are used to treat patients, but the fact is that patients have to wait for 2 years for such medications. During the course of those 2 years, the health of the patient deteriorates very quickly, and this waiting has an indirect effect on costs as well. Rita is a patient, and she has experienced all of the harsh problems with the healthcare sector which were mentioned by Professor Andersone, because her diagnosis was not determined in a timely way, and as a result she did not receive her medication on time. She found herself in a wheelchair over the course of 2 years. I hope that this project will help others more than it helped me. I hope that the medication will not be taken away from me too soon, and that everything will be successful so that I am once again able to go to work. It was suggested during the discussion that Latvia must improve the early diagnosis of patients who suffer musculoskeletal problems, therapeutic procedures, and rehabilitation and reintegration of patients into the labor market. It must also be ensured that preservation of the ability to work is the main result of the treatment. In order to achieve this, there must be a working group to draft a national management plan for diseases related to the musculoskeletal system. Participants signed a memorandum of understanding which emphasizes the need to expand the level of information about musculoskeletal disorders in the area of healthcare and welfare. I think that this first meeting was very successful. Experts are familiar with their work and can explain it in an understandable way while also sharing in their experience and views. The goals are clear. The main goal is the quality of life of each patient from a purely human perspective, And this is important for society when this is seen as an economic category. Ours is by no means a unique process in Europe. Many countries have already identified these problems, and they have moved further and more deeply than we have done.
Šīs problēmas jau apzinājušies, teiksim tā, mazliet tālāk un dziļāk nekā mēs. Cooperation
and partnerships are of great importance here. I believe that our involvement in this joint European project will allow us to move forward in a sufficiently rapid, rational, and effective way.